In our Newsy Tonight focus this evening, we turn to a public health crisis, which looks poised to get much deadlier. Nearly 600,000 people across the United States and Canada died from opioid overdoses in the past 2 decades. Let that sink in, more than 500,000. Now, a new projection just released tonight estimates twice as many people, more than 1 million, will die by opioids by the end of this decade. The study says, in part, quote, because the opioid crisis developed over decades, tragically, many future deaths are inevitable at this point. Newsy national correspondent Maritza Giorgio has more.
The stories are all too common in far too many communities across the country.
He had his wisdom teeth out, and that was his first exposure to pain medication.
Families like 20-year-old Robbie Brandt left shattered as prescription painkillers turned to addictions, and addictions turned to death.
There was no warning or be careful about this. It was just, here's your prescription.
Since 1999, nearly 600,000 people have died of opioid overdose deaths across the U.S. and Canada. An alarming new study published in the Lancet projects 1.2 million more could die of overdoses by the end of this decade. That rate of death would surpass the worst of the HIV/AIDS epidemic.
It really is almost incomprehensible how extensive the epidemic is.
The study, led by researchers at Stanford University, traces the origins of the crisis to the 1990s, when the pharmaceutical industry pushed powerful opioids without much resistance from the government or healthcare providers.
Their jobs were to monitor the information and control the flow of those medications. That was their job. That was the law. And they chose not to do that. People up and down the supply chain made conscious decisions to do this for profit, and people died.
The reality got worse as illegal drugs became more widespread. Drugs like heroin and fentanyl, a drug so powerful, even a single pill can kill.
So if you were to picture just 2 granulars of salt or sugar, or picture the tip of a pencil, that's a sufficient dose to kill somebody.
The DEA is now cracking down, or at least trying to. People are dying from fentanyl overdoses, sometimes without even realizing they're taking it.
The public's thinking that they're getting an oxycodone pill, hydrocodone pill, or even an Adderall pill. But what these pills are, they look exactly the same as you would get in a pharmacy. However, they've been produced in a laboratory, in a garage in Mexico.
All of this contributed to make 2020 the deadliest year on record for opioid deaths, more than 76,000 across the U.S. and Canada. The Stanford researchers found the COVID pandemic contributed by limiting access to opioid addiction services, overwhelming healthcare systems, plus added stressors like unemployment and loss of loved ones. Those researchers are now calling for better regulation, industry reform, and new methods of managing pain.
You're not talking about even becoming addicted to an illicit drug. You're talking about losing your life the first time.
And Chance, researchers found the COVID pandemic definitely worse than the opioid crisis, but the situation was already dire, even though states like Montana have tried to crack down on opioid prescriptions and increase the supply of the life-saving drug Narcan.
Maritza Giorgio, feels like we can see the iceberg. Now the question is, can we turn the boat on time? Let's bring in Dr. Vanila Singh tonight for some perspective on the estimated 1.2 million opioid overdose deaths we can expect this decade. Dr. Singh is the former chief medical officer for the United States Department of Health and Human Services. Dr. Singh, what I'd like to do is break this into 2 categories, if we could, the medical and then the recreational side. So on the medical side, doctors, they're not prescribing in vast quantities opioids like they used to. You know, I can imagine you get a tooth pulled, you might need one. Pain management, which you know a lot about, is still needed by millions of people. So what is to be done in that category?
Yeah, so great question. And actually, this is a big topic that we focused on when I was chief medical officer. The key is that this is always nuanced. People with painful chronic conditions, often intractable, often things that may even make them consider suicide because it's an effect on their quality of life. You have to look at it from what is the underlying mechanism? What are the options? There's often a multitude of options, and they may need to be done in parallel. So medicines that are not necessarily opioids, or maybe opioids, interventions, procedures, behavioral health, complementary integrative approaches, including acupuncture. So taking all of that into account, having those resources, and ensuring that you keep function and quality of life as your main metric. Those are things that I definitely look at.
On the recreational side, which is the illegal side here, most of the deaths that we're seeing, they're from fentanyl at this point. You know, even in pills, they get it online. It might be on one of the social media apps. They think I'm going to buy Adderall, Valium, whatever. They get it, they take it, they die. You know, they never thought they were going to take fentanyl. Is education the key on the recreational side? Is interdiction the key at the U.S.-Mexico border?
Yeah, so Chance, this is the focus. It is illicit drugs that are the main driver of the opioid overdose crisis that we're seeing right now, by and large. In fact, to the point where people who have actual indications for prescription opioids are not getting it. And in fact, it is so substantive that even illicit methamphetamines, cocaine, and other drugs are on the market. And we really have to get to the bottom of this, and we have to stop the supply, which is coming from overseas and clandestine labs. The DEA has identified the synthetic illicit opioids, the synthetic cocaine. These are all coming across the border. We need to double up our efforts and really focus in on this if we want to prevent those overdose deaths that everyone is focused on right now. It's tragic.
Finally, Dr. Singh, I don't want to overlook what it may seem out of place, but what I'd call the heart piece of this, because we know the risks. You know, young people in this country, they've heard the sermons, they've seen the PSAs, but the problem keeps getting worse, and we're talking about 1.2 million lives. At the heart level, you know, what should we be doing?
We need to really, as a society, have compassion for folks who have mental health issues, who have stressors. We need to open up the ability to talk about anxiety, about depression, about things that people may not feel like they can live up to. We need support. We need family. We need friends. People are in isolation. The pandemic has definitely exacerbated this. This is why, though prescription opioids were down 30 to 50%, overdose deaths were up. And this is really from the pandemic, where the illicit fentanyl really. So it's really about getting people together and opening up our ability to hear others who need help.
Connectedness, so important. Dr. Vanilla Singh, thank you.